In this video, we'll be covering nasal bone imaging, specifically the CPT codes, standard radiographic views, and a sample radiology report. For nasal bone imaging, the primary code used is 70160. This code is defined as radiologic examination, nasal bones, complete, minimum of 3 views. This code is assigned when at least 3 views of the nasal bones are performed. These typically include right and left lateral views for comparison, as well as a tangential or Waters view to assess for fracture displacement. Importantly, if fewer than 3 views are taken, in such cases, reduced service modifier 52 may apply based on payer guidelines. The standard views for a complete nasal bone series include right lateral view, left lateral view, tangential or Waters view. These views collectively fulfill the minimum of 3 views requirement outlined for this CPT code. Here is a sample radiology report based on a typical nasal bone exam, Order CPT 70160. Order exam, nasal bones, 3 views. Right lateral, left lateral, Waters and AP view radiographs of the nasal bones. History, fracture. Patient was reportedly seen outside the facility with a broken nose, now shifted with continued bruising and swelling. Comparison, none. Findings, nasal bone fracture with less than 2 mm displacement apparent on lateral view radiographs. Orthodontic hardware and ear piercings are noted. Impression, nasal bone fracture with less than 2 mm displacement visualized clearly on lateral views. When coding the diagnosis for the nasal bone fracture described in this report, the most appropriate ICD-10-CM code is S022XX-A, fracture of nasal bones, initial encounter. Let's break it down. S022 identifies the fracture of the nasal bones. The XX are placeholders required to meet ICD-10's 7-character format. The final character A indicates this is the initial encounter for active treatment. Always confirm documentation supports both the anatomical location and the encounter phase before assigning the ICD-10 code. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content.